I am super excited about today's video. Number one, it's because I have my new smartboard behind me. Well, it's not new, but it's the first time I've used it in a very long time. And so I blacked it all out so it'll actually look like a chalkboard or a blackboard. Shout out to all the students who have gone back to school for the school year. But what we're going to talk about today is the new prices that the government has negotiated with drug manufacturers on behalf of Medicare beneficiaries. So this morning I was at an event. It was a Medicare Advantage member event for a health plan client of ours. And one of the very first beneficiaries that sit in my chair said, "Hey, I watched the Today Show this morning and they were talking about my Eliquis is now going to be cheaper for me due to the government negotiating these prices." And so I had not watched the Today Show yet. So I was like, okay, I know what you're talking about because it has to do with the Inflation Reduction Act, blah, 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 blah. So I went over everything with her, but then I'm thinking in my head, this is a great content strategy and idea for later. So hello later. So what I did was I did a quick Google search after she left to see what the Today Show was actually talking about. So for history, the government has already picked what those 10 drugs are going to be. They picked them in 2023. Now they've completed negotiations. So what does that actually mean for the beneficiary? So that's what we're going to go over today. Now, I'm only going to talk about the savings to the member. I'm not going to go over, like the Today Show did, into the savings to the government or who that cost is now being shifted to, which is the health plan. I'm only looking at it from the Medicare beneficiary standpoint. Okay, so later on in the member event, I had another Medicare beneficiary come up to me and they're on Xarelto. And he said, well, you know, I went to get my Xarelto filled yesterday at the pharmacy and they told me it was going to be $180 some odd. He said for a 90-day supply, but if I got a 60-day supply, it was only going to cost me $84. And so I immediately knew that this is what we call a straddle claim, meaning he was almost in the donut hole, but the whole amount of his 90 days wasn't in the donut hole. So I tried to explain that to him, and then I told him, I said, well, next year, guess what? The donut hole no longer exists, so you don't have to worry about it. And so I asked him, I said, if you're really nerdy like me when it comes to this stuff, look what just happened this morning. And his drug Xarelto is actually on the list for the negotiated drugs. And I'm going to show you how this would have affected him and maybe even you with this new negotiated price. So let's get started. So the drug we're going to use is Xarelto. It was one of the 10 drugs, one of the very first 10 drugs that CMS, the Centers for Medicare and Medicaid Services, chose as one to negotiate with the drug manufacturers. Now, in the article that I've got listed below, the list price for Xarelto is $517 for a 30-day supply. And that's about what I saw for this particular gentleman today whenever we were going over his example. Well, now the new negotiated price that'll take place January 1st, 2026 is going to be $197. Okay, so a 30-day supply is going from $517 to $197 for the cost of that drug, all because now CMS has been able to negotiate the price of this drug of Xarelto. So we're going to look at it two different ways. We're going to look at it for 2024, which is where we're at, and then we're going to look at it for 2026. Okay, so in 2024, which is where we're at right now, where this gentleman was today, his list price for the Xarelto was $517 for a 30-day supply. Now, there's a couple things you're going to have to know in order for this to work for you. In order for this to be helpful, we've got to know the 4 stages, or we've got to know the 4 drug payment stages. So there's the deductible phase. And in the deductible phase, you're going to pay 100% of the cost of your drug, okay? We're not going to talk about if anything's excluded. You're just going to pay 100% of the cost of the drug. Then you go into what we call the initial coverage limit phase, and there you're just going to pay your copay. And we're going to say his copay for Xarelto is $50. We're just going to make it a nice, easy number, okay? Then there's the donut hole, also known as the coverage gap. And when you get here, you're paying 25% of the cost of the drug. So let's go over here to our handy calculator. I just love this smart board. All right, and so if it's $517 times 0.25, $129.25. So let's zoom in. I don't know if that's going to show up, but it's okay. So 25% of the $517 list price is $129. and 25 cents is what he would have paid for a 30-day supply of the Xarelto. And then we have Catastrophic is the last and final phase for 2024, and if he makes it here, he pays $0. So I'm not going to go over how you get through all these phases because I have that in a different video. But what I do want you to be able to see is that the price that he pays fluctuates depending on what phase he was actually in. Okay, so now this Catastrophic is $0 for 2024. Here's a fun fact. In 2023, he would have been responsible for 5% of the cost of the Xarelto. But also thanks to the Inflation Reduction Act, Catastrophic members now pay $0 whenever they get to Catastrophic phase. All right, so that's 2024. The new negotiated price is $197. Does not go... This new negotiated price of $197 does not go into effect until 2026. Okay, so let's jump past next year, 2025, and let's look into 2026, just with everything as it is now. All right, so what he would have been paying, let's see if another color will show up here. Yeah, it will. So what he would have been paying in 2026 is this. The deductible, he's paying 100% of it. So he's only going to pay $197 because the list price or the negotiated price is now $197 versus $517. Okay. Now, if his deductible was lower than $197 or lower than $517, he just pay up to the deductible. But we're going to assume that he's paying 100% for the cost of the drug. All right, and then during ICL, he's still going to pay his plain old $50, his copay. Well, check this out. In 2025, guess what else is going away? You got it, the donut hole is going away. So there will no longer be a donut hole. So therefore, he's going to continue to just pay his $50 copay after he hits the deductible until he hits Catastrophic. And when he gets into Catastrophic, he's going to pay $0. So let's see what his actual savings were going to be. So in 2024, let me go back to my other color, and let's see what his total would have been. So we add up the $517 plus the $50 plus the $129.25. So that is $696.25. And so we're just using this very simple example. It gets more complicated than this, but we're just using what we have on the screen, $696.25. All right, now let's go into 2026 and see what he would have paid. So it's $197 plus 50. So his total is $247 versus $696.25. So how much did he save? $696.25 minus $247, he saves $449.25. Now, if you like math like I do, let's see what that equals as a percentage. So we'll take the $449.25 and divide it by the $696.25. That's 65% savings. All due thanks to the Inflation Reduction Act and this new negotiated drug price. Okay, so what I want you to get from here is there is going to be cost savings for the Medicare beneficiary. Now, however, if this would have occurred when the donut hole actually existed, wouldn't that have been nice that he could have taken advantage of this lower list price this year? Because then he would have only had to pay 25% of the $197, which would have been $49.25 is what this could have been released or decreased to if it had this list price. Okay, so that would have been pretty cool. So I'm not going to say day late, dollar short, because this is a significant amount of savings, even though he's not going to be able to take advantage of it now. Now, a couple of things you're probably saying, well, Renata, what if my plan does not have a deductible? Because a lot of these plans do not have a deductible. So maybe you do not have one. You're like, so this is not going to save me any money. You're absolutely correct. Because if this plan did not have a deductible, this particular person would have continued to pay $50 for the entire time until they got to Catastrophic and they paid $0. However, where this also is going to help you is if you have a drug that is on a tier of your formulary that has a co-insurance. And so like a bunch of specialty drugs that sit on tier 5 or maybe tier 6, if that's the specialty tier, they come with sometimes a 33% co-insurance. And so anytime you have to pay a percentage of the cost of a drug, this is where your list price is going to come in handy because it's going to be lower. So you'd much rather pay 33% of $197 than you would to pay 33% of $517. So I hope that you have found this video helpful. This was very exciting to actually draw out and map out. I hope this shows up very well on the screen. So if you have any examples or if you have any questions that you want to ask me, please drop it below. We're going to continue to follow the Inflation Reduction Act, continue to put things up. I'm actually got another video that's coming up about how you can pay $0 at the pharmacy next year. So if you can go to the pharmacy next year and your copay should be $50 or it should be $197 because you're in the deductible, but what if I told you you will be able to next year walk out of the pharmacy, not give them $197 and not give them $50, and you can still walk out with your medicine? Do you find that interesting? If so, check out this new video on how you can pay $0 at the pharmacy counter in 2025.